So, hello everyone. I am Dr. Shivani Jain, ophthalmology mentor at the Doctutorials, and it's my proud privilege to talk to two meritorious students, Dr. Jesna Shibu and Dr. Aneesh, who have scored such great ranks, such great numbers in the recent FMGE exam. So, Dr. Jesna and Dr. Aneesh, heartiest congratulations to you from my side
Thank
and
you, ma'am.
everybody at Doctutorials.
Thank you, ma'am.
I'm
Thank you,
on
ma'am.
cloud, right?
Yeah, sure.
Yeah, so how does it feel, when you actually see your hard work finally paying off? Dr. Jess now.
I'm feeling so happy, so excited. Actually, I'm really shocked seeing my result. I didn't expect this much score.
But we were expecting this. You were a good student. We have been looking at you, so you were a very good student. So this is not a shocking score. This is wonderful. Great. Dr. Jesna and Dr. Anish, you both were preparing and you were good, you were doing good. So can you please tell me something about your journey? When did you
Uh,
start preparation?
for exclusively for purely for FMG exam, only 4 months we are dedicated uh,
But we started
because
our preparation around 1 year before.
yeah,
Right.
Along with our studies, we started our preparation.
yeah,
Uh-huh. So you've been consistent, if I can say. It's the consistency actually which finally paid off, right?
Yes, ma'am.
Okay.
yes, ma'am,
So
yes,
both of
ma'am.
you were Doc Tutorial subscribers. So can you please tell us how Doc Tutorials helped you in your preparation?
We have purchased the QRP like the Vegeta plan,
Okay.
and also the live program. So all the faculties very short, very crisp, and exact to the point. So for the 4 months, it's a golden package for us because
Exactly.
because in the 4 months we want to get minimum 2-3 revisions. That's important for us. The QRP videos length is very short, so it make us to reach the goal very quickly. That's the thing.
Yeah, yeah.
Especially
Dr.
if I
Jesna,
say I'm too much in love with the QRP plan. If we compare with the other faculty, other platforms and all, the QRP session is so crisp and precise. It's
yeah,
not too
yeah.
lengthy. It's to the point.
Yeah, yeah, yeah. So I've got this review from many of the students because it is not very short. Like ophthalmology, we have given 8.5 hours, which is not like 3-4 hours of rapid revision, and it is not my regular videos, like 40 hours of regular videos. So it's somewhere between, you can do everything from your QRP.
Yeah.
Okay,
Yeah.
so can
Within
you
a
please
short
tell us?
period, too much information are given.
Yeah. So,
And also the
Dr.
live
Jeff now. Yes, Dr. Anish, you are saying something about the live
uh,
program?
and also the QRP and the live program. These the combinations has worked very perfectly. And also GTs of doc tutorials. Like when we do the GTs before from the before 1 year, the GTs were somewhat easier. So we think about FMGs that the FMG is a screening test, it will be easier. So when we do the doc tutorials GT, we think that, oh, it's very hard. What is this? But we don't. We both discuss and we decide that we want to face these GTs, even though it's hard. We want to face
And
it.
also the video explanations, it were too good.
Yes, ma'am.
Yes,
Uh,
yes.
the thing is that to the juniors, I have said that we want to feel the weight and the pressure only by doing a good GT. This is the only way we want to know the real exam feelings because we get absolutely good marks in GTs. Then we think that the FMG when we do the FMG main exam, it will be easier. But when we sit on the chair and when the question come, the first thought in my mind is that is it an FMG exam? That's the first thing that we have thought. Then I go to the next question. Then also, in case, especially ophthalmology, we all see the slides and things. Then it's nothing. Every like in case of the dendritic ulcer, it's not an image. It's explanation how it looks like that. So it's give a and also in the options we have 4 options. 2 options we can delete. Yeah, it's good.
Yeah, easily
The
we
other
can
two
rule out two
option
options. The other two options were so much confusing.
Yes, yes. So, Dr.
So
Jesna, would you like to tell, yeah, Dr. Jesna, would you like to tell something about the PYTs, PYQs, the importance of PYTs? Like all the faculties have recorded, or the video explanations with all the questions. So that is a very, very good session for all the students to learn. So, did you go through those PYTs?
Yeah, I've gone through the PYTs and PYQs. Actually, the PYTs and PYQs plays a major role in the exam. I'll definitely say that we should go through at least 5 years of previous year questions, and not just in FMGE, also the NEET PG questions for sure.
And Dr. Anish?
the we want to do the last 5 years question, but the thing is that the question of the previous year is very direct. That's a problem. But in the main exam, the question is somewhat like in that pressure, in that surroundings, that mindset. It's a complex, it's a big complex that question comes. So the thing is that we want to do the previous year PWTs, that's okay, but we want to do hard questions also. When we do hard questions, we will increase the reading skills, the analyzing skills. So only doing a medium to tough questions in a, like the 50 questions section in the FMG pattern. So when I do the exam, in every section 50 questions, I get minimum 10 to 15 minutes more. So this helped me to review the 50 question once more for me.
Yes,
So
yes.
many of my friends think that the question is tough, so I don't get that much time to review the question. So in this time, the only thing is that we want to get the speed and the concept. We want to balance those two things. That's the most important from my side.
Yes, yes, yes. So you've put in a lot of effort for that. You've balanced GTs, you've balanced the QRP, the PYTs, and of course, everything in a short span of time. So that's too much of work for you. Dr. Jess, now, any special subject or anything would you like to mention about the faculties or any particular subject that you have read thoroughly from Doctor Tutorials app?
Especially if I say I like the END session by Dr. Rajiv Dhawan sir, ophthalmology from you, and the pediatric session from Sandeep Sharma sir.
Yes,
Also
yes.
the
And
medicine by Rahul Rajiv sir.
Dr. Anish,
For me,
what's
like
your favorite subject from Doctor Tutorials? Okay.
most of the faculties are good. It's no, I don't see the main difference between the faculties, especially ophthalmology and also the medicine. In the medicine, the QRP 5.0 is very crisp. I don't know any other platform to provide that much crispness.
Yes,
Uh,
yes, yes.
so uh, yeah, the way we choose the doctorals is a perfect uh, option for us. Yeah.
Thank you
Especially
for your
for the
kind
last
words,
four
both of
months.
you. Thanks to both of you for your kind words. Okay, so one single tip, both of you. What would you like to tell your juniors, your colleagues who could not make this time? Dr. Anish, first you.
As I
What would you
said,
like to
there
advise?
there are many friends who will say to you that don't do GTs like that stuff. But I want to say that uh, do GTs, do PYTs, and study in a conceptual way as possible. And the main thing that saved me in this exam, I think that I have a good concept in some of my major subjects like surgery, uh, then biochemistry, physio. Then I think that these subjects will save me. That's my idea. But the real exam, the subject that I'm weaker, like psychiatry, anesthesia, pediatrics, ortho, these I have scored more. So I want to
Mm,
say that you want
okay.
to study all the subjects. You want to study all the subjects for sure.
Yes, you should not skip any subject. You can read it
Yeah.
in a retrograde way, crisp way, shorter way, but there's no point in skipping one subject. That's one very good
Of
piece of advice that you have given to your colleagues and juniors. Dr. Jesna, what piece of advice would you like to give to your juniors?
I'll say them to concentrate more on revision and doing questions. Many of
Hmm.
I know many of my friends and my juniors, they are afraid to do questions. We want to
Yes.
test ourselves. what we study after studying the topic, we want to go through the Q bank. Then we will understand the mistakes, and from the mistakes we will learn.
Very true.
Personally, if I
Very
say
true.
I've learned many of the topics through my mistakes, through the questions. So I'll, of
Of
course,
course.
I'll say to my juniors the same.
Of course, because they are not asking you theory. Theory is something which you can learn, which you can understand. But how to reproduce that theory, that knowledge in the exam is particularly by the questions. So
Yeah.
MCQs has to be done. So doc tutorials has that special Q bank that is tailored by the faculties themselves. So with that, thank you very much to both of you for sparing some time for us.
Thank you,
So
ma'am, for
blessed
this
with
whole
your interview,
wonderful section.
and say my regards to your parents as well. So bless
Yes,
both of you, and shall meet again when you are preparing for your NEET PG exam. So good
Yes,
luck to
yeah,
ma'am.
both of
sure.
Sure.
you and do well in your life. Thank you.
Thank you, ma'am.
Thank you so much,
Thank you,
ma'am.
ma'am.
And thanks for all the
Thank you.
support.
Thank you. Bye bye.
Bye.
Bye.